Do you want to successfully complete the D033 objective assessment exam? Then you are in the right place. Our website provides a list of questions and answers for your success in the D033 OA exam for free. We understand that acing your OA exam can be quite challenging. That's why we provide completely free exam guides and practice questions for you. In this video, we will cover questions from system performance, data analytics, interoperability levels, change management, and data quality. So, let's get started. 1. A hospital experiences frequent system crashes during peak admission hours affecting patient registration. Which approach would best address this operational challenge while maintaining data integrity and system performance? A. Implement volume testing. B. Deploy hot site backup. C. Configure load balancing. D. Enable single sign-on. Can you guess the answer? Correct answer, C. Configure load balancing. Explanation. Option C is correct because load balancing distributes system traffic across multiple servers, preventing crashes during peak usage while maintaining continuous operations and data integrity. Option A is incorrect because volume testing only identifies capacity issues during the testing phase, but doesn't solve operational performance problems in production. Option B is incorrect because hot sites are disaster recovery solutions for complete system failures, not performance optimization during regular high-volume periods. Option D is incorrect because single sign-on improves user authentication efficiency, but doesn't address system performance or capacity issues during peak loads. Let's explore a critical concept in healthcare IT infrastructure. When a hospital faces system crashes during peak admission hours, we need to understand the difference between performance optimization and disaster recovery. Load balancing is the key here. It's like having multiple checkout lanes at a grocery store. Instead of everyone crowding into one lane causing delays, the traffic gets distributed evenly across multiple servers. This prevents any single server from becoming overwhelmed during busy periods, like morning admissions or shift changes. Volume testing just identifies problems during testing phase but doesn't fix live issues. Hot sites are for complete disasters, not peak performance. And single sign-on? That's about authentication efficiency, not system capacity. Load balancing maintains continuous operations by intelligently distributing the workload. 2. Your healthcare facility needs to track medication administration errors across departments. Which data analytics category would provide the most valuable insights for preventing future incidents? A. Descriptive analytics only. B. Predictive analytics primarily. C. Prescriptive analytics alone. D. Business intelligence exclusively. Do you know the answer? Correct answer, B. Predictive analytics primarily. Explanation. Option B is correct because predictive analytics uses historical error data to identify patterns and forecast potential future incidents, enabling proactive prevention strategies and targeted interventions. Option A is incorrect because descriptive analytics only summarizes past events without providing insights into future risks or prevention opportunities. Option C is incorrect because prescriptive analytics, which recommends actions, requires predictive insights first to understand the potential outcomes of different choices. Option D is incorrect because business intelligence primarily supports strategic decisions rather than clinical safety pattern recognition and prevention. Now let's dive into the power of data analytics for preventing medication errors. When tracking medication administration errors across departments, we have 4 main types of analytics to consider. Descriptive analytics tells us what happened. It's like reading yesterday's newspaper. But predictive analytics, that's our crystal ball. It looks at patterns in historical error data to identify when and where future incidents are likely to occur. Think of it like weather forecasting. We use past patterns to predict future storms. This enables proactive prevention strategies before errors happen. Prescriptive analytics needs those predictions first, and business intelligence focuses on strategic decisions rather than clinical safety patterns. The key is identifying patterns to prevent problems, not just counting them after they occur. 3. A physician needs immediate access to a patient's imaging results from multiple facilities during emergency surgery. Which interoperability level is most critical for this time-sensitive clinical scenario? A. Foundational interoperability sufficient. B. Structural interoperability required. C. Semantic interoperability essential. D. Organizational interoperability needed. Can you guess the answer? Correct answer, C. Semantic interoperability essential. Explanation: option C is correct because semantic interoperability ensures different systems can exchange, interpret, and use imaging data meaningfully, critical for accurate clinical decision-making during surgery. Option A is incorrect because foundational interoperability only enables basic data exchange without ensuring the receiving system can interpret the information. Option B is incorrect because structural interoperability defines data format, but doesn't guarantee clinical meaning is preserved across systems. Option D is incorrect because organizational interoperability addresses governance and policies rather than technical data exchange and interpretation capabilities. Understanding interoperability levels is crucial for emergency care scenarios. Imagine a surgeon in the operating room who needs immediate access to imaging results from multiple facilities. We have 4 levels of interoperability to consider. Foundational just sends data, like mailing a letter in a foreign language. Structural defines the format, like having the right envelope. But semantic interoperability, that ensures the receiving system can actually understand and use the imaging data meaningfully. It's like having a universal translator that preserves medical meaning across different systems. Without semantic interoperability, the surgeon might receive the data but couldn't interpret it correctly for critical decisions. Organizational interoperability is about policies and governance, not the technical ability to share and understand clinical data during surgery. 4. During EHR implementation, staff resist changing from paper charts, citing workflow disruption concerns. What change management strategy would most effectively address this resistance while ensuring successful adoption? A. Mandate immediate compliance. B. Implement Big Bang. C. Create user task forces. D. Delay training sessions. Do you know the answer? Correct answer, C. Create user task forces. Explanation: option C is correct because user task forces engage staff in the implementation process, addressing concerns directly while building ownership and reducing resistance through participation. Option A is incorrect because mandating compliance without addressing concerns increases resistance and may lead to workarounds compromising system effectiveness. Option B is incorrect because Big Bang implementation intensifies disruption and resistance by changing everything simultaneously without gradual adjustment. Option D is incorrect because delaying training prolongs uncertainty and prevents staff from developing confidence with the new system. Let's examine effective change management during EHR implementation. When staff resist transitioning from paper charts, citing workflow disruption, we need the right strategy. Think about human psychology. People resist what's forced upon them, but embrace what they help create. A user task force engages staff directly in the implementation process. It's like having the nurses and doctors design their own workspace rather than having it imposed. This builds ownership and reduces resistance through participation. Mandating compliance without addressing concerns just increases resistance and leads to dangerous workarounds. The Big Bang approach changes everything at once, intensifying disruption. And delaying training, that just prolongs uncertainty. The key is making staff partners in change, not victims of it. 5. A hospital's patient portal shows inconsistent lab results between different access points. Which data quality characteristic needs immediate attention to resolve this patient safety issue? A. Data comprehensiveness primarily. B. Data granularity specifically. C. Data accessibility mainly. D. Data consistency urgently. Can you guess the answer? Correct answer, D. Data consistency urgently. Explanation. Option D is correct because data consistency ensures identical information appears uniformly across all access points, critical for preventing medical errors from conflicting lab results. Option A is incorrect because comprehensiveness relates to the completeness of records rather than the uniformity of specific data across systems. Option B is incorrect because granularity concerns the level of detail in data rather than consistency across different viewing platforms. Option C is incorrect because accessibility addresses the ability to retrieve data, not the uniformity of that data across platforms. Data quality in healthcare can be a matter of life and death. When a patient portal shows different lab results at different access points, we're dealing with a data consistency problem. Imagine a diabetic patient checking their glucose levels, seeing 95 on their phone, but 195 on their computer. That's not just confusing, it's dangerous. Data consistency ensures the same information appears identically everywhere, every time. It's different from comprehensiveness, which is about having complete records. Granularity refers to the level of detail. Accessibility is about being able to retrieve data. But consistency, that's about uniformity across all platforms. Without it, patients and providers make decisions based on conflicting information, risking serious medical errors. 6. Your organization must comply with HIPAA security rule requirements for electronic protected health information. Which technical safeguard provides the most comprehensive protection against unauthorized access? A. Capture implementation only. B. Password policies alone. C. Audit control system. D. Token authentication exclusively. Do you know the answer? Correct answer, C. Audit control system. Explanation. Option C is correct because audit controls provide comprehensive monitoring of all system activities, creating trails for investigating breaches and ensuring compliance with access policies. Option A is incorrect because capture only prevents automated attacks and does not monitor legitimate user activities or detect insider threats. Option B is incorrect because password policies alone do not track actual system usage or detect unauthorized access after authentication. Option D is incorrect because token authentication only verifies identity at login without monitoring subsequent activities or access patterns. HIPAA security rule compliance requires multiple layers of technical safeguards. Let's understand why audit controls provide the most comprehensive protection. Think of audit controls like security cameras that record everything, not just who enters, but what they do inside. While capture prevents bots, passwords verify identity, and tokens authenticate users, audit controls create a complete trail of all system activities. They're like a detailed logbook showing who accessed what patient record, when, and what changes they made. This helps investigate breaches and ensures compliance. Capture only stops automated attacks. Password policies don't track actual usage. Token authentication just verifies identity at login. But audit controls, they monitor everything continuously, catching both external threats and insider misuse. 7. A clinic wants to reduce medical coding errors and improve reimbursement accuracy. Which HIM information system would best achieve both objectives through automated clinical documentation analysis? A. Encoder software only. B. Chart deficiency system. C. Computer-assisted coding. D. Disclosure tracking system. Can you guess the answer? Correct answer, C. Computer-assisted coding. Explanation. Option C is correct because computer-assisted coding uses natural language processing to analyze clinical documentation automatically, improving coding accuracy and identifying missed reimbursement opportunities. Option A is incorrect because encoders assist with code lookup, but do not automatically analyze clinical documentation for coding opportunities. Option B is incorrect because chart deficiency systems track missing documentation rather than analyzing existing documentation for coding. Option D is incorrect because disclosure tracking manages information release requests, not coding accuracy or reimbursement optimization. Medical coding accuracy directly impacts healthcare revenue. Let's explore how computer-assisted coding revolutionizes this process. Traditional encoders just help look up codes, like using a digital dictionary. Chart deficiency systems track what's missing. Disclosure systems manage information releases. But computer-assisted coding? It uses natural language processing to read clinical documentation like a skilled coder would. Imagine having an assistant that reads every physician note, identifying diagnoses and procedures you might miss. It analyzes the actual clinical documentation, not just helping with code lookup. This improves accuracy and finds missed reimbursement opportunities. It's the difference between having a dictionary versus having an expert reader who understands context and meaning, catching coding opportunities humans might overlook. 8. During parallel testing of a new pharmacy system, discrepancies appear between old and new system outputs. What critical step should occur before proceeding with go live implementation? A. Skip to training. B. Begin data conversion. C. Conduct acceptance testing. D. Initiate scope creep. Do you know the answer? Correct answer, C. Conduct acceptance testing. Explanation. Option C is correct because acceptance testing validates that discrepancies are resolved and the system meets requirements before implementation, preventing medication errors during go-live. Option A is incorrect because training on a system with unresolved discrepancies would teach incorrect processes and compromise patient safety. Option B is incorrect because data conversion before resolving discrepancies would propagate errors into the new system permanently. Option D is incorrect because scope creep refers to uncontrolled project expansion, not a testing phase or implementation step. Parallel testing is a critical safety checkpoint before any pharmacy system goes live. When discrepancies appear between old and new systems, we're at a crossroads. Think of it like test driving a car with faulty brakes. You wouldn't buy it without fixing the problem first. Acceptance testing validates that all discrepancies are resolved, and the system meets requirements. This prevents medication errors during go-live. Skipping to training with unresolved issues means teaching incorrect processes. Starting data conversion propagates errors permanently into the new system. Scope creep isn't even a testing phase, it's uncontrolled project expansion. The key is ensuring the new system produces accurate results before trusting it with real patient medications. 9. A healthcare network needs to share patient records across facilities while maintaining local control of data. Which health information exchange architecture best balances autonomy with accessibility needs? A. Centralized model preferred. B. Hybrid federated approach optimal. C. Decentralized structure only. D. Direct exchange sufficient. Can you guess the answer? Correct answer, B. Hybrid federated approach, optimal. Explanation: option B is correct because hybrid federated architecture maintains local data control while enabling centralized record location services, balancing organizational autonomy with network-wide accessibility. Option A is incorrect because centralized models require organizations to relinquish data control to a central repository, reducing autonomy. Option C is incorrect because purely decentralized structures lack efficient mechanisms for locating records across the network quickly. Option D is incorrect because direct exchange only supports point-to-point communication without network-wide record location capabilities. Healthcare networks face a classic dilemma: sharing patient records while maintaining local control. Let's explore HIE architectures. A centralized model requires giving up your data to a central repository, like moving all your files to someone else's computer. Decentralized keeps everything local, but makes finding records across the network difficult. Direct exchange only works point to point. But hybrid federated? It's the best of both worlds. Think of it like a library catalog system. Each library keeps its own books, but there's a central catalog showing where everything is. Organizations maintain control of their data locally, while a central registry helps locate records quickly across the network. This balances organizational autonomy with network-wide accessibility perfectly. 10. Your facility implements telehealth services, but patients report difficulty accessing virtual appointments. Which consumer informatics principle should guide the solution to improve health equity? A. Increase jargon usage. B. Ignore health literacy. C. Address digital divide. D. Reduce portal features. Do you know the answer? Correct answer: C. Address digital divide. Explanation: option C is correct because addressing the digital divide ensures equitable access by considering technology availability, internet connectivity, and digital skills across patient populations. Option A is incorrect because increasing jargon creates barriers to understanding and reduces accessibility for patients with limited health literacy. Option B is incorrect because ignoring health literacy perpetuates disparities and prevents effective patient engagement with telehealth services. Option D is incorrect because reducing features limits functionality for all users rather than improving accessibility for underserved populations. Telehealth promises healthcare access for everyone, but implementation reveals a harsh reality: the digital divide. When patients can't access virtual appointments, we must address the root cause. It's not about adding more jargon or reducing features. The digital divide encompasses 3 barriers: technology availability, internet connectivity, and digital skills. Imagine a rural patient with no broadband, an outdated computer, and limited tech knowledge. Ignoring health literacy worsens the problem. Reducing portal features limits everyone. But addressing the digital divide? That means ensuring equitable access through infrastructure, devices, and training. It's about building bridges, not walls, to healthcare access. 11. A hospital's master patient index contains duplicate records causing medication administration errors. Which data management strategy would most effectively prevent future patient identification issues? A. Implement MPI system. B. Disable ADT feeds. C. Remove data dictionary. D. Eliminate required fields. Can you guess the answer? Correct answer: A. Implement MP system. Explanation: option A is correct because an enterprise master patient index consolidates patient identities across systems, preventing duplicates through sophisticated matching algorithms and unique identifier management. Option B is incorrect because admission, discharge, and transfer feeds provide critical registration data, and disabling them would worsen identification problems. Option C is incorrect because data dictionaries define standards that help prevent inconsistencies leading to duplicate records. Option D is incorrect because required fields ensure complete identification information, reducing the likelihood of creating duplicate records. Duplicate patient records are more than an inconvenience, they're a patient safety crisis. When the master patient index contains duplicates, medication errors can occur. Imagine John Smith and John Smith being treated as different patients when they're the same person. An enterprise master patient index, or MPI, consolidates identities across all systems using sophisticated matching algorithms. It's like having a super smart receptionist who recognizes patients despite name variations, address changes, or typos. Disabling ADT feeds would worsen the problem by losing registration data. Removing data dictionaries eliminates standards that prevent inconsistencies. Eliminating required fields allows incomplete information. But MPI, it's the master key that ensures one patient equals one record across the entire enterprise. 12. Clinical decision support alerts fire too frequently, causing alert fatigue among providers. Which modification would improve system effectiveness while maintaining patient safety standards? A. Disable all alerts. B. Increase alert frequency. C. Customize alert thresholds. D. Remove clinical decision support entirely. Do you know the answer? Correct answer. C. Customize alert thresholds. Explanation. Option C is correct because customizing thresholds based on clinical context and provider specialty reduces unnecessary alerts while preserving critical safety warnings. Option A is incorrect because disabling all alerts eliminates important safety checks and increases risk of medical errors. Option B is incorrect because increasing frequency worsens alert fatigue, causing providers to ignore important warnings. Option D is incorrect because removing clinical decision support eliminates evidence-based guidance that improves care quality. Alert fatigue is a silent killer in clinical decision support systems. When alerts fire too frequently, providers start ignoring them, even the critical ones. It's like a smoke alarm that goes off every time you make toast. Eventually you ignore it, even during a real fire. The solution isn't to disable all alerts or increase their frequency. That's dangerous. Removing CDS entirely eliminates evidence-based guidance. But customizing alert thresholds, that's the sweet spot. We can set different levels based on clinical context and provider specialty. A cardiologist needs different alerts than a pediatrician. By showing only clinically significant interactions prominently, we reduce noise while preserving critical safety warnings. Smart customization saves lives. 13. During system selection, stakeholders disagree on priorities between clinical features and financial reporting capabilities. Which tool best facilitates objective vendor comparison for final decision-making? A. Force majeure clause. B. Weighted decision matrix. C. Alpha site testing. D. External scanning only. Can you guess the answer? Correct answer, B. Weighted decision matrix. Explanation. Option B is correct because weighted decision matrices assign numerical values to criteria based on importance, enabling objective comparison of vendors across diverse stakeholder priorities. Option A is incorrect because force majeure clauses address contract exceptions for uncontrollable events, not vendor selection decisions. Option C is incorrect because alpha site testing occurs after vendor selection to test early software versions. Option D is incorrect because external scanning identifies market options but doesn't provide a structured comparison methodology. System selection often becomes a battlefield of competing priorities. Clinical staff want features for patient care, Finance wants reporting capabilities. How do we make an objective decision? Enter the weighted decision matrix. It's like having an impartial judge. Each criterion gets a numerical weight based on importance. Clinical features might score 40%, financial reporting 30%, and so on. Then we rate each vendor against these criteria. The math doesn't lie. Force majeure clauses are for contracts, not selection. Alpha testing happens after choosing. External scanning just identifies options. But a weighted matrix? It transforms subjective arguments into objective scores, enabling fair comparison across diverse stakeholder priorities. Numbers beat opinions. 14. A data breach exposes patient records requiring immediate response. According to HIPAA security rule, which action takes priority to minimize harm while preserving evidence? A. Delete all logs. B. Ignore the incident. C. Begin forensic investigation. D. Disable all backups. Do you know the answer? Correct answer, C. Begin forensic investigation. Explanation. Option C is correct because forensic investigation preserves evidence while identifying breach scope and affected records, enabling proper notification and mitigation efforts. Option A is incorrect because deleting logs destroys evidence needed for investigation and violates regulatory requirements for the incident documentation. Option B is incorrect because ignoring incidents violates HIPAA requirements and prevents mitigation of ongoing harm to patients. Option D is incorrect because disabling backups eliminates recovery options and potentially worsens the incident's impact. A data breach is every healthcare organisation's nightmare. When patient records are exposed, every second counts. The HIPAA security rule demands immediate action, but not the kind you might think. Deleting logs destroys evidence. That's like cleaning up a crime scene. Ignoring it violates regulations. Disabling backups worsens the damage. The priority is forensic investigation. Think of it as healthcare CSI. We preserve evidence while identifying the breach scope and affected records. This tells us who to notify and how to stop ongoing harm. It's a delicate balance. We need to minimize damage while maintaining evidence for law enforcement and regulatory compliance. Proper investigation protects both patients and the organisation. 15. Your organisation struggles with physician adoption of computerised provider order entry. Which benefits should be emphasised to demonstrate direct value to clinical workflow efficiency? A. Increased paperwork requirements. B. Reduced decision support. C. Elimination of errors. D. Slower order processing. Can you guess the answer? Correct answer, C. Elimination of errors. Explanation. Option C is correct because computerized provider orders entry eliminates transcription errors and illegible handwriting while providing real-time checking for drug interactions and allergies. Option A is incorrect because computerized provider order entry reduces paperwork by eliminating handwritten orders and manual transcription processes. Option B is incorrect because computerized provider order entry enhances decision support through integrated clinical guidelines and automated safety checks. Option D is incorrect because computerized provider order entry accelerates order processing through immediate electronic transmission to relevant departments. Getting physicians to adopt computerized provider order entry can feel like pushing a boulder uphill. The key is showing them what's in it for them. More paperwork? No, CPOE actually reduces it. Less decision support? The opposite? It enhances it. Slower processing? Wrong again. But eliminating errors? Now we're talking. CPOE eliminates the deadly problem of illegible handwriting. No more guessing if that's 5 milligrams or 50 milligrams. It catches drug interactions in real time before they harm patients. Orders transmit instantly to pharmacy and labs. No more lost papers or transcription errors. When physicians see CPOE as their safety net, not their burden, adoption soars. It's about patient safety and efficiency, not just technology. 16. A facility planning cloud computing adoption needs to address data security concerns. Which consideration most directly impacts HIPAA compliance for electronic protected health information storage? A. Color scheme selection. B. Business associate agreements. C. Reduced storage costs. D. Faster processing speeds. Do you know the answer? Correct answer, B. Business associate agreements. Explanation. Option B is correct because cloud providers handling electronic protected health information must sign business associate agreements, ensuring HIPAA compliance and defining security responsibilities. Option A is incorrect because color schemes are aesthetic choices unrelated to security or regulatory compliance requirements. Option C is incorrect because cost reduction doesn't address security obligations or compliance requirements for protected health information. Option D is incorrect because processing speed improvements don't ensure data protection or regulatory compliance. Cloud computing for healthcare sounds great until you hit the hyper wall. Storing electronic protected health information in the cloud isn't just about cost savings or processing speed. The color scheme of the interface? Irrelevant. But business associate agreements? That's the cornerstone of compliance. Any cloud provider touching EPHI must sign a BAA. It's a legal contract defining exactly how they'll protect patient data and what happens if they fail. Think of it as a prenuptial agreement for data relationships. Without it, you're violating HIPAA before you even start. The BAA defines security responsibilities, breach procedures, and liability. It's not optional. It's the foundation that makes cloud computing legally possible for healthcare. 17. Quality reporting requirements under MIPS evaluation include multiple performance categories. Which category most directly reflects patient-centered care delivery improvements through technology adoption? A. Cost reduction only. B. Advancing care information. C. Marketing effectiveness metrics. D. Staff satisfaction scores. Can you guess the answer? Correct answer, B. Advancing care information. Explanation. Option B is correct because advancing care information measures meaningful use of certified EHR technology to improve patient engagement and care coordination. Option A is incorrect because cost measures evaluate resource use efficiency rather than technology-enabled care improvements. Option C is incorrect because marketing metrics aren't included in MIPS Quality Payment Programme performance categories. Option D is incorrect because staff satisfaction isn't a MIPS category, though it may indirectly impact performance. Quality reporting under MIPS determines how Medicare pays providers. It's not about cost-cutting or marketing metrics. Staff satisfaction doesn't count either. The key category is advancing care information. It measures how meaningfully providers use certified EHR technology. Think of it as a report card for digital transformation. Are you using technology to actually improve patient care? This includes patient portals for engagement, electronic prescribing for safety, and health information exchange for coordination. It's not just having the technology, it's using it to advance care. Providers who excel get payment bonuses. Those who don't face penalties. Technology adoption directly impacts the bottom line through better patient-centered care. 18. A registry system needs enhancement to support population health initiatives. Which data element would provide the most valuable insights for addressing community health disparities? A. Favorite color preferences. B. Social determinant factors. C. Recreational hobby choices. D. Entertainment viewing habits. Do you know the answer? Correct answer, B. Social determinant factors. Explanation. Option B is correct because social determinants including housing, education, and food security significantly impact health outcomes and guide targeted interventions. Option A is incorrect because colour preferences have no relevance to health outcomes or disparity identification. Option C is incorrect because hobby choices rarely correlate with health disparities, requiring population-level interventions. Option D is incorrect because entertainment habits don't provide actionable data for addressing health inequities. Population health initiatives need the right data to address health disparities. Favourite colours and hobbies won't help identify community health needs. Entertainment habits are irrelevant. But social determinant factors, these are the game changers. We're talking about housing stability, education levels, food security, transportation access. These factors account for up to 80% of health outcomes. A diabetic patient without refrigeration can't store insulin. Someone without transportation misses appointments. Food insecurity leads to poor nutrition. By capturing social determinants in our registries, we identify the real barriers to health. This guides targeted interventions, like mobile clinics for transportation issues or food pharmacy programs for nutrition. It's about treating the whole person, not just the disease. 19. During re-engineering before system implementation, employees express concerns about job security. Which approach best addresses fears while ensuring successful process improvement? A. Terminate resistant staff. B. Hide change plans. C. Involve staff participation. D. Postpone all changes. Can you guess the answer? Correct answer, C. Involve staff participation. Explanation. Option C is correct because staff participation in re-engineering identifies improvement opportunities while building ownership and reducing fears through transparency. Option A is incorrect because terminating staff increases fear and resistance while losing valuable institutional knowledge. Option B is incorrect because hiding plans increases suspicion and prevents staff from preparing for changes. Option D is incorrect because postponing changes doesn't address underlying concerns and delays necessary improvements. Re-engineering processes before system implementation triggers deep fears about job security. Terminating resistant staff destroys morale and loses valuable knowledge. Hiding plans breed suspicion and rumours. Postponing changes just delays the inevitable. The solution involves staff participation from day one. When employees help redesign their own workflows, they become architects of change, not victims. They identify inefficiencies that management might miss. They feel ownership over the new processes. Their expertise shapes better solutions. It's like renovating your own house versus having someone else redesign it without asking. Participation transforms fear into engagement, resistance into ownership. People support what they help create. 20. Your organisation evaluates benefits of health information exchange participation. Which operational improvement most directly enhances emergency department efficiency? A. Reduced duplicate testing. B. Increased paper forms. C. Slower lab processing. D. Manual record requests. Do you know the answer? Correct answer, A. Reduced duplicate testing. Explanation. Option A is correct because HIE access to previous test results eliminates unnecessary duplicate testing, reducing costs and expediting emergency treatment. Option B is incorrect because HIE reduces paper usage through an electronic exchange rather than increasing forms. Option C is incorrect because HIE doesn't slow lab processing and may accelerate it through electronic ordering. Option D is incorrect because HIE automates record exchange, eliminating manual request processes. Emergency departments are ground zero for the benefits of health information exchange. The game changer? Reduce duplicate testing. Picture this: an unconscious patient arrives. Without HIE, you'd repeat every test. Blood work, imaging, everything, because you can't access their recent results. With HIE, you instantly see they had a CT scan yesterday at another hospital. That's time saved, money saved, and most importantly, faster treatment. HIE doesn't increase paper forms, it reduces them. It doesn't slow processing, it accelerates it through the electronic ordering. It eliminates manual record requests entirely. Every avoided duplicate test means less radiation exposure, less cost, and faster diagnosis. In emergencies, minutes matter. HIE gives those minutes back. 21. A physician practice implements structured data capture, but providers complain about increased documentation time. Which solution balances data quality needs with workflow efficiency? A. Return to paper. B. Remove all templates. C. Optimize template design. D. Eliminate documentation requirements. Can you guess the answer? Correct answer: C. Optimize template design. Explanation. Option C is correct because well-designed templates with smart phrases and logical flow reduce documentation time while maintaining structured data capture benefits. Option A is incorrect because returning to paper sacrifices data quality, searchability, and decision support capabilities. Option B is incorrect because removing templates eliminates structure needed for data analytics and quality reporting. Option D is incorrect because documentation is legally required and essential for continuity of care. Let's tackle a common physician complaint about structured data capture, increasing documentation time. The problem isn't the structure itself, it's poor template design. Think of it like filling out a badly designed form versus a smart one. Returning to paper sacrifices all our data quality and analytics capabilities. Removing templates eliminates the structure we need for reporting. Eliminating documentation, that's illegal and dangerous, but optimizing template design, that's the solution. Smart templates with logical flow, auto-populated fields, and smart phrases can actually reduce documentation time. It's like having a personal assistant who knows exactly what you need to say. Well-designed templates guide physicians through documentation efficiently while maintaining the structured data we need for quality reporting and analytics. 22. Network diagnostics reveal interface testing failures between laboratory and pharmacy systems. Which testing approach would most comprehensively validate data exchange before go live? A. Skip all testing. B. Unit testing only. C. Volume testing alone. D. Integration testing comprehensive. Do you know the answer? Correct answer: D. Integration testing comprehensive. Explanation. Option D is correct because comprehensive integration testing validates data exchange between systems, including format, timing, and error handling across interfaces, ensuring the systems work together as expected. Option A is incorrect because skipping all testing guarantees failures during live operations, risking patient safety and making the system unreliable. Option B is incorrect because unit testing only validates individual components without testing system interactions, which is insufficient for complex data exchange. Option C is incorrect because volume testing evaluates capacity but doesn't validate data exchange accuracy, so interface errors could still exist. When laboratory and pharmacy systems can't talk to each other, patient safety is at risk. Interface testing failures are red flags that must be addressed before go-live. Skip testing? That's a guarantee for disaster. Unit testing only checks individual pieces, missing the critical connections. Volume testing tells us about capacity, not accuracy, but comprehensive integration testing. That's what validates the entire data exchange process. It checks if the lab result format matches what pharmacy expects, if timing is synchronized, and how errors are handled. Think of it like testing a relay race. Each runner might be fast individually, but can they pass the baton smoothly? Integration testing ensures systems work together seamlessly, preventing medication errors from miscommunication. 23. Patient portal adoption remains low despite marketing efforts. Analysis reveals health literacy barriers. Which evidence-based intervention would most effectively improve engagement? A. Increase medical terminology. B. Remove educational content. C. Implement Ask Me. D. Disable portal access. Can you guess the answer? Correct answer, C. Implement Ask Me. Explanation: option C is correct because the Ask Me 3 initiative helps patients understand their conditions by focusing on 3 key questions using plain language. Option A is incorrect because increasing medical terminology worsens health literacy barriers and reduces portal usage. Option B is incorrect because educational content helps patients understand their health when presented appropriately using plain language. Option D is incorrect because disabling access eliminates engagement opportunities rather than addressing barriers. Low patient portal adoption despite marketing often points to one culprit: health literacy barriers. Adding more medical terminology makes it worse, like speaking louder to someone who doesn't understand your language. Removing educational content abandons patients who need guidance. Disabling the portal eliminates opportunity entirely. The Ask Me 3 initiative is brilliantly simple. It teaches patients to focus on 3 essential questions. What is my main problem? What do I need to do? Why is it important for me to do this? Using plain language, it cuts through medical jargon. Instead of hyperlipidemia management protocols, we say ways to lower your cholesterol. This evidence-based approach transforms confusing portals into accessible tools that patients actually use. 24. A hospital experiences repeated malware infections despite antivirus software. Which additional security measure would most effectively prevent future incidents? A. Remove all computers. B. Disable email system. C. User security training. D. Eliminate internet access. Do you know the answer? Correct answer, C. User security training. Explanation: option C is correct because security training teaches staff to recognize phishing attempts and suspicious attachments, preventing malware introduction through human error. Option A is incorrect because removing all computers eliminates essential tools for modern healthcare delivery. Option B is incorrect because disabling the email system would cripple critical communication channels within the hospital. Option D is incorrect because eliminating internet access would prevent access to important resources and updates. Repeated malware infections despite antivirus software tell us technology alone isn't enough. The weakest link in cybersecurity isn't the software, it's the human. Removing all computers? That's like closing the hospital. Disabling email cuts vital communication. Eliminating internet blocks essential services. But user security training? That's addressing the root cause. Most malware enters through human error. Clicking phishing emails, downloading suspicious files, using infected USB drives. Training teaches staff to recognize threats, suspicious sender addresses, urgent payment requests, unexpected attachments. It's like teaching someone to recognize counterfeit money. Once they know the signs, they become the first line of defense. Technology catches known threats. Trained humans prevent new ones from entering. 25. System implementation requires data conversion from legacy databases. Which quality check ensures accurate medication dosages transfer correctly, preventing potential patient harm? A. Skip validation completely. B. Parallel testing verification. C. Delete source data. D. Random sampling only. Can you guess the answer? Correct answer, B. Parallel testing verification. Explanation. Option B is correct because parallel testing runs both systems simultaneously, comparing outputs to verify accurate data conversion, including critical medication information. Option A is incorrect because skipping validation risks transferring errors that could cause medication errors and patient harm. Option C is incorrect because deleting source data eliminates ability to verify conversion accuracy or recover from errors. Option D is incorrect because random sampling might miss critical errors in medication data requiring complete validation. Data conversion from legacy systems is where patient safety meets technical precision. Medication dosages can't have even tiny errors. 0.5 milligrams becoming 5 milligrams could be fatal. Skipping validation is playing Russian roulette with patient lives. Deleting source data removes our safety net for verification. Random sampling might miss critical errors in specific drug categories, but parallel testing verification, it's our guardian angel. Both systems run simultaneously, comparing every output. If the old system says 2.5 milligrams of warfarin and the new says 25 milligrams, we catch it before go live. It's like having a proofreader check every single word in a dictionary. Time consuming? Yes. Necessary? Absolutely. When medication data is involved, perfection isn't optional. 26. Your facility participates in value-based care programs requiring quality metric reporting. Which information system capability most directly supports accurate performance measurement? A. Gaming system integration. B. Entertainment portal access. C. Clinical documentation improvement. D. Social media monitoring. Do you know the answer? Correct answer, C. Clinical documentation improvement. Explanation. Option C is correct because clinical documentation improvement systems ensure complete and accurate documentation, which supports precise quality metric calculation and appropriate reimbursement under value-based models. Option A is incorrect because gaming systems have no relevance to healthcare quality measurement or reporting. Option B is incorrect because entertainment portals don't contribute to clinical quality metrics or performance measurement. Option D is incorrect because social media monitoring doesn't provide clinical data needed for quality reporting. Value-based care flips healthcare payment on its head. You're paid for quality, not quantity. Gaming systems and entertainment portals have nothing to do with healthcare metrics. Social media monitoring misses the clinical mark. But clinical documentation improvement, or CDI, that's the engine driving accurate quality measurement. CDI ensures physicians document the complete clinical picture. Without it, a heart failure patient might be coded as having simple shortness of breath, understating severity, and losing reimbursement. CDI specialists review documentation, query physicians for clarification, and ensure the record reflects true clinical complexity. It's like having an editor who ensures your story is complete and accurate. Under value-based models, incomplete documentation means incorrect quality scores and lost revenue. 27. During RFP evaluation, a vendor demonstrates superior functionality but poor financial stability. Which risk assessment factor should receive highest priority in selection decision? A. Logo design quality. B. Office location proximity. C. Long-term viability concerns. D. Executive personality traits. Can you guess the answer? Correct answer, C. Long-term viability concerns. Explanation. Option C is correct because vendor financial instability risks system support loss, upgrade availability, and potential data migration, necessitating careful evaluation. Option A is incorrect because logo design has no impact on system functionality or vendor reliability. Option B is incorrect because physical proximity is less important than financial stability with modern remote support. Option D is incorrect because personality traits don't determine vendor capability to maintain and support systems. Choosing a vendor is like choosing a business partner for the next decade. Logo design and office location don't matter when the company might not exist next year. Executive personalities are fleeting, but long-term viability, that's everything. A vendor with poor financial stability might go bankrupt, leaving you stranded without support, updates, or even data access. Imagine your EHR vendor disappearing overnight. No help desk, no security patches, no upgrade path. You'd face massive migration costs and operational disruption. Financial stability assessment looks at revenue trends, customer base, market position, and debt levels. It's not glamorous, but it's critical. The best system in the world is worthless if the vendor won't be around to support it. 28. A multi-facility health system needs standardized clinical pathways across locations. Which system feature would best ensure consistent, evidence-based care delivery? A. Randomized treatment selection. B. Provider preference override. C. Integrated guideline alerts. D. Pathway deletion capability. Do you know the answer? Correct answer, C. Integrated guideline alerts. Explanation. Option C is correct, because integrated alerts prompt providers to follow evidence-based pathways while allowing clinical judgment for patient-specific variations. Option A is incorrect because randomized treatment violates evidence-based practice and potentially harms patients. Option B is incorrect because unlimited override capability defeats the purpose of standardization, even though some flexibility is needed. Option D is incorrect because deleting pathways eliminates standardization rather than ensuring consistent care. Standardizing care across multiple facilities requires balancing consistency with clinical judgment. Randomized treatment violates medical ethics. Complete provider override defeats standardization. Deleting pathways eliminates evidence-based care entirely. Integrated guideline alerts strike the perfect balance. They're like GPS navigation for clinical decisions, showing the recommended route while allowing detours when needed. When a pneumonia patient arrives, alerts prompt the evidence-based pathway, specific antibiotics, timing, dosages. But if the patient has allergies or complications, providers can vary treatment with documented reasons. This ensures baseline quality while preserving clinical autonomy. It's not rigid protocol enforcement. It's intelligent guidance that improves outcomes while respecting physician expertise. Consistency without tyranny. 29. Post-implementation evaluation reveals slower than expected system response times. Which performance optimization approach would provide the most sustainable improvement? A. Reduce user numbers. B. Database index optimization. C. Eliminate all features. D. Downgrade hardware capacity. Can you guess the answer? Correct answer, B. Database index optimization. Explanation. Option B is correct because database indexing improves query performance systematically without reducing functionality or user access. Option A is incorrect because reducing users limits system utility and doesn't address underlying performance issues. Option C is incorrect because eliminating features reduces system value without necessarily improving performance. Option D is incorrect because downgrading hardware worsens performance problems rather than solving them. Post-implementation performance problems demand surgical precision in diagnosis and treatment. Reducing users treats the symptom, not the disease. Eliminating features cripples functionality. Downgrading hardware makes things worse. But database index optimization, that's targeted therapy. Think of a database like a massive library. Without indexes, finding information means checking every single book. With proper indexing, you go straight to the right shelf. Slow queries that took minutes suddenly complete in seconds. It's systematic improvement without sacrificing anything. Creating indexes on frequently searched fields, removing redundant indexes, and rebuilding fragmented ones transforms system responsiveness. Unlike quick fixes that create new problems, index optimization provides sustainable performance gains. It's the difference between amputation and precision surgery. 30. Privacy concerns arise about personal health record data governance. Which regulatory framework primarily determines protection requirements for untethered PHR systems? A. HIPAA always applies. B. No regulations exist. C. Consumer protection laws. D. International maritime law. Do you know the answer? Correct answer, C. Consumer protection laws. Explanation? Option C is correct, because consumer protection laws are what primarily determine the protection requirements for untethered personal health record systems. These laws address how personal information is collected, used, and protected by companies. Option A is incorrect because HIPAA applies to covered entities such as healthcare providers, health plans, and healthcare clearinghouses, but does not generally apply to untethered personal health record systems. Option B is incorrect because consumer protection and privacy laws do apply to personal health record vendors. Option D is incorrect because international maritime law governs activities at sea and has no relevance to personal health record privacy protection. Personal health records exist in a regulatory grey area that surprises many people. HIPAA doesn't always apply. That's a common misconception. International maritime law is obviously irrelevant. Saying no regulations exist is wrong and dangerous. The truth: consumer protection laws govern untethered PHRs. Here's the key distinction. If a PHR is offered by your health plan or provider, HIPAA applies, but independent PHR apps you download yourself? They fall under FTC regulations and state consumer protection laws. It's like the difference between a bank vault and a home safe. Both store valuables, but different rules apply. This matters because consumer protection laws offer different, often weaker privacy protections than HIPAA. Users need to understand what they're agreeing to. 31. A healthcare organisation discovers unauthorised access to patient records by an employee. Which administrative safeguard would most effectively prevent similar incidents? A. Remove all access. B. Workforce clearance procedures. C. Eliminate audit logs. D. Disable encryption systems. Can you guess the answer? Correct answer, B. Workforce clearance procedures. Explanation. Option B is correct because clearance procedures ensure appropriate background checks and access authorization based on job responsibilities, preventing unauthorized access. Option A is incorrect because removing all access prevents legitimate work while not addressing the root cause of inappropriate access. Option C is incorrect because audit logs are essential for detecting unauthorized access and shouldn't be eliminated. Option D is incorrect because encryption protects data at rest and in transit, but doesn't prevent authorized user misuse. Preventing unauthorized employee access to patient records requires proactive administrative safeguards. Removing all access paralyzes operations. Eliminating audit logs blinds us to violations. Disabling encryption doesn't stop authorized users from snooping. Workforce clearance procedures are the frontline defense. Think of it as extreme vetting for a position of trust. These procedures include comprehensive background checks, verification of credentials, and role-specific access authorization. Before someone gets the keys to patient data, we verify they should have them. It's not just criminal checks, it's ensuring access aligns with job responsibilities, A billing clerk shouldn't access psychiatric notes. A radiologist shouldn't view billing records. Clearance procedures establish and enforce these boundaries from day one. 32. Clinical staff report documentation burden from copy-paste functionality misuse. Which policy intervention best maintains efficiency while ensuring documentation integrity? A. Ban all copying. B. Require source attribution. C. Delete documentation tools. D. Prevent record creation. Do you know the answer? Correct answer, B. Require source attribution. Explanation. Option B is correct because attribution policies maintain copy-paste efficiency benefits while ensuring documentation accuracy and identifying information sources. Option A is incorrect because complete bans eliminate legitimate efficiency gains from reusing accurate information appropriately. Option C is incorrect because documentation tools are essential for patient care and regulatory compliance. Option D is incorrect because preventing record creation violates legal requirements and compromises patient care. Copy-paste functionality in EHRs is a double-edged sword, efficient but potentially dangerous. Banning or copying eliminates legitimate efficiency gains. Deleting documentation tools cripples the system. Preventing record creation violates legal requirements. The solution? Require source attribution. It's like academic citations for medical records. When information is copied, the system tracks and displays where it came from and when. This maintains the efficiency of reusing accurate information, vital signs, medication lists, histories, while ensuring transparency. If an error propagates through copying, we can trace it back. If information becomes outdated, we know its origin. Attribution preserves the benefits while adding accountability. It's the difference between plagiarism and proper citation. 33. Your organization implements computerized physician order entry, but experiences high override rates for drug interaction alerts. Which modification would improve alert acceptance? A. Eliminate all checking. B. Alert for everything. C. Tiered severity levels. D. Random alert display. Can you guess the answer? Correct answer, C. Tiered severity levels. Explanation. Option C is correct because severity tiering displays only clinically significant interactions prominently, reducing alert fatigue while preserving critical warnings. Option A is incorrect because eliminating drug interaction checking increases medication error risk significantly. Option B is incorrect because alerting for every interaction increases fatigue, causing important warnings to be ignored. Option D is incorrect because random display creates inconsistency and confusion, compromising patient safety. Drug interaction alerts save lives, but too many alerts numb providers into ignoring them all. Eliminating checking invites disaster. Alerting for everything creates alert fatigue. Random displays cause confusion. Tiered severity levels provide intelligent filtering. Think of it like emergency room triage. Not every patient needs immediate attention. Level 1 alerts might be life-threatening interactions that always display prominently. Level 2 could be moderate risks, shown based on patient factors. Level 3 might be minor interactions available on request. This way, the aspirin-warfarin interaction that could cause fatal bleeding gets attention, while the calcium-vitamin D interaction doesn't interrupt workflow. Providers see what matters most without drowning in noise. It's precision alerting that maintains safety while preserving sanity. 34. Data analytics reveal care coordination gaps between primary and specialty care. Which HIE feature would most directly address this quality improvement opportunity? A. Billing system integration. B. Continuity of care. C. Entertainment portal linkage. D. Cafeteria menu sharing. Do you know the answer? Correct answer, B, continuity of care. Explanation, option B is correct because continuity of care documents provide standardized summaries, ensuring specialists receive complete patient information for coordinated treatment. Option A is incorrect because billing integration addresses financial processes rather than clinical care coordination. Option C is incorrect because entertainment portals have no relevance to care coordination between providers. Option D is incorrect because cafeteria menus don't contribute to clinical care coordination or quality improvement. Care coordination gaps between primary and specialty care are where patients fall through cracks. Billing system integration handles money, not medicine. Entertainment portals and cafeteria menus are obviously irrelevant. Continuity of care documents, or CCDs, bridge the gap. They're like medical passports that travel with patients between providers. CCDs provide standardized summaries containing diagnoses, medications, allergies, recent procedures, and care plans. When your primary doctor refers you to a cardiologist, the CCD ensures nothing gets lost in translation. The specialist sees your complete picture, not just the referral reason. This prevents dangerous oversights like prescribing medications that interact with existing drugs. HIE makes CCDs instantly available, transforming fragmented care into coordinated treatment. 35. Screen design principles indicate inconsistent navigation, causing user errors. Which standardization approach would most improve usability while maintaining functionality? A. Random layout changes. B. Removal navigation. C. Consistent interface patterns. D. Different every screen. Can you guess the answer? Correct answer, C. Consistent interface patterns. Explanation. Option C is correct because consistent interface patterns reduce cognitive load and errors by allowing users to develop automatic behaviors. Option A is incorrect because random changes increase errors and user frustration while reducing efficiency. Option B is incorrect because removing navigation prevents users from accessing needed functions and information. Option D is incorrect because different layouts on every screen maximizes confusion and error potential. Poor screen navigation is a hidden productivity killer in healthcare systems. Random layout changes create chaos. Removing all navigation makes systems unusable. Different layouts on every screen maximizes confusion. Consistent interface patterns are the solution. Think about driving through. Imagine if every car had the steering wheel in a different place. Chaos, right? Same principle applies to healthcare software. When buttons, menus, and navigation elements stay in predictable locations, users develop muscle memory. They stop thinking about how to use the system and focus on patient care. A nurse shouldn't hunt for the medication order button. A doctor shouldn't search for lab results. Consistency reduces cognitive load, minimizes errors, and accelerates workflows. Boring? Maybe. Effective? Absolutely. 36. Disaster recovery planning reveals inadequate backup procedures risking data loss. Which backup strategy provides optimal protection for mission-critical healthcare systems? A. Never backup data. B. Annual backup only. C. Real-time replication plus. D. Delete after backup. Do you know the answer? Correct answer, C. Real-time replication plus. Explanation. Option C is correct because real-time replication with periodic full backups minimizes data loss while ensuring rapid recovery capability. Option A is incorrect because no backups guarantees permanent data loss during system failures or disasters. Option B is incorrect because annual backups risk losing up to a year of critical patient data. Option D is incorrect because deleting data after backup eliminates the original, creating a single point of failure. Disaster recovery for healthcare systems isn't optional, it's life or death. Never backing up guarantees catastrophic loss. Annual backups risk losing a year of critical data. Deleting after backup creates single points of failure. Real-time replication plus periodic full backups provides optimal protection. Think of it as wearing both a seatbelt and having airbags. Real-time replication mirrors every change instantly to a secondary site. If the primary fails, you switch over with minimal data loss, maybe seconds or minutes. Periodic full backups provide additional recovery points and protection against data corruption. Together, they ensure rapid recovery with minimal loss. In healthcare, where every record could save a life, this redundancy isn't paranoia. It's prudent. 37. Training evaluation shows varying learning speeds among clinical staff. Which adult learning principle best addresses this challenge during system implementation? A. Ignore individual differences. B. Self-paced learning modules. C. Eliminate all training. D. Single training method. Can you guess the answer? Correct answer, B. Self-paced learning modules. Explanation: Option B is correct because self-paced modules accommodate different learning speeds while ensuring all staff achieve competency before system use. Option A is incorrect because ignoring differences leaves some staff unprepared, risking errors and resistance. Option C is incorrect because eliminating training guarantees implementation, failure, and potential patient harm. Option D is incorrect because single methods don't accommodate different learning styles and speeds effectively. Training clinical staff for new systems reveals a fundamental challenge. Everyone learns differently and at different speeds. Ignoring these differences leaves slower learners behind and frustrates quick learners. Eliminating training guarantees failure. Using only one method alienates learning styles. Self-paced learning modules accommodate everyone. It's like having a personal tutor available 24/7. Quick learners can speed through basics and dive into advanced features. Methodical learners can repeat sections until comfortable. Visual learners can focus on video content. While readers can use text guides, staff can train during quiet night shifts or busy day breaks. Everyone reaches competency at their own pace before touching real patient data. No one falls through the cracks. 38. Population health analysis requires social determinant data integration. Which data collection approach best balances comprehensiveness with patient privacy concerns? A. Collect everything possible. B. Minimum necessary principle. C. No data collection. D. Random data selection. Do you know the answer? Correct answer, B. Minimum necessary principle. Explanation: Option B is correct because the minimum necessary principle focuses on collecting only the essential social determinant data required for effective interventions, thus protecting patient privacy while still enabling meaningful analysis. Option A is incorrect because collecting everything possible disregards patient privacy and can lead to the collection of irrelevant or sensitive information, potentially discouraging patient participation. Option C is incorrect because no data collection would prevent the identification of social factors that significantly impact health outcomes, making it impossible to address health disparities effectively. Option D is incorrect because random data selection would provide inconsistent and unreliable data, rendering it unsuitable for accurate population health planning and targeted interventions. Collecting social determinant data for population health walks a tightrope between comprehensiveness and privacy. Collecting everything possible violates privacy and discourages participation. No collection prevents identifying crucial health barriers. Random selection gives unreliable data, the minimum necessary principle strikes the perfect balance. It's like a doctor asking only relevant questions during an exam. We collect housing status because homelessness affects medication storage. We ask about transportation because it impacts appointment attendance. Food security matters for nutrition counselling, but we don't need to know every detail of someone's life. This targeted approach respects privacy while gathering actionable data. Patients are more willing to share when they understand we're collecting only what's needed to help them. 39. Scope creep threatens project timeline during system implementation. Which project management tool most effectively controls requirements while maintaining stakeholder engagement? A. Ignore all requests. B. Accept everything immediately. C. Change control process. D. Eliminate stakeholder input. Can you guess the answer? Correct answer: C. Change control process. Explanation. Option C is correct because formal change control evaluates requests against project goals, managing scope while considering legitimate needs. Option A is incorrect because ignoring requests damages stakeholder relationships and may miss critical requirements. Option B is incorrect because accepting everything causes uncontrolled expansion, budget overruns, and project failure. Option D is incorrect because eliminating input prevents identification of essential requirements and reduces buy-in. Scope creep is the silent project killer that turns manageable implementations into endless nightmares. Ignoring all requests damages relationships and misses critical needs. Accepting everything causes budget overruns and delays. Eliminating stakeholder input reduces buy-in and misses requirements. A formal change control process manages the chaos. Think of it as a traffic control system for new requirements. Each request gets documented, evaluated for impact on timeline and budget, and assessed against project goals. Legitimate critical needs get approved with adjusted resources. Nice-to-haves get deferred to Phase 2. This isn't bureaucracy, it's survival. It maintains stakeholder engagement while protecting the project from death by 1,000 additions. Control without rigidity. 40. Revenue cycle analysis shows coding accuracy issues impacting reimbursement. Which technology solution would provide the most comprehensive improvement? A. Manual coding only. B. Natural language processing. C. Eliminate all coding. D. Random code assignment. Do you know the answer? Correct answer: B. Natural language processing. Explanation. Option B is correct because natural language processing analyzes clinical documentation comprehensively, identifying coding opportunities and ensuring accuracy beyond manual review capabilities. Option A is incorrect because manual coding alone is slower and more error-prone than technology-assisted approaches. Option C is incorrect because coding is required for reimbursement, and eliminating it prevents payment. Option D is incorrect because random assignment violates regulations and results in incorrect reimbursement or fraud. Revenue cycle problems from coding inaccuracy demand sophisticated solutions. Manual coding alone is slow and error-prone. Eliminating coding prevents reimbursement entirely. Random code assignment is fraud. Natural language processing transforms the game. NLP reads clinical documentation like an expert coder with superhuman speed. It understands context, medical terminology, and coding guidelines. When a physician documents patient presented with chest pain radiating to left arm with diaphoresis, NLP recognizes potential acute MI and suggests appropriate codes. It catches missed comorbidities that increase reimbursement. It identifies documentation that supports higher complexity levels. Unlike basic tools that just look up codes, NLP comprehensively analyzes the entire record. More accuracy, more revenue, less audit risk. 41. Interoperability challenges prevent effective care transitions between facilities. Which technical standard most directly enables semantic data exchange? A. Proprietary formats only. B. Paper printouts exclusively. C. HL7 EFA implementation. D. Incompatible custom protocols. Can you guess the answer? Correct answer, C. HL7 for implementation. Explanation. Option C is correct because EFA standards enable semantic interoperability through standardized resources and APIs, facilitating meaningful data exchange. Option A is incorrect because proprietary formats prevent interoperability by requiring custom interfaces between systems. Option B is incorrect because paper printouts eliminate electronic exchange benefits and require manual re-entry. Option D is incorrect because incompatible protocols prevent any meaningful data exchange between systems. Alright, let's dive into the technical backbone of healthcare data exchange. When care transitions fail between facilities, it's often because systems speak different languages. Proprietary formats create isolated islands. Paper printouts destroy all electronic benefits. Incompatible protocols prevent any meaningful exchange. But HL7 for fast healthcare interoperability resources is the universal translator. Think of it like the USB standard that lets any device connect to any computer. FIR uses modern web standards, RESTful APIs, and standardized resources that any system can understand. It doesn't just move data, it preserves meaning. A blood pressure reading sent via FHIR arrives with its context, units, and clinical significance intact. This semantic interoperability enables true care coordination across any platform. 42. Patient matching errors create safety risks across the health information exchange. Which technology enhancement would most effectively reduce duplicate record creation? A. Disable matching algorithms. B. Biometric identification integration. C. Use names only. D. Random number assignment. Do you know the answer? Correct answer, B. Biometric identification integration. Explanation. Option B is correct because biometric identifiers provide unique, unchangeable patient identification, reducing duplicates and matching errors significantly. Option A is incorrect because disabling algorithms increases duplicates and makes record matching impossible. Option C is incorrect because name-only matching creates numerous duplicates due to common names and variations. Option D is incorrect because random numbers don't prevent duplicate creation and complicate record matching. Patient matching errors in health information exchanges can literally kill. When John Smith becomes two different patients, medications get missed or duplicated. Disabling matching algorithms creates chaos. Using names only fails with common names. Random numbers can't prevent duplicates. Biometric identification is the game changer. Your fingerprint, iris scan, or palm vein pattern is unique. It never changes, never gets misspelled, never gets confused. Think of it as nature's perfect ID card. When an unconscious patient arrives at the emergency room, their fingerprint instantly pulls the right record, not someone else's with a similar name. No more duplicate records from name variations, address changes, or data entry errors. Biometrics provides certainty in patient identification where traditional methods fail. 43. Post-implementation review identifies inadequate user support causing productivity losses. Which support model best balances cost-effectiveness with user satisfaction? A. No support provided. B. Tiered support structure. C. Executive support only. D. Random support assignment. Can you guess the answer? Correct answer, B. Tiered support structure. Explanation. Option B is correct because a tiered support structure allows for quick resolution of simple issues at a lower cost, while more complex problems are escalated to specialists, balancing cost-effectiveness with user satisfaction. Option A is incorrect because providing no support will likely cause user frustration, workarounds, and potential system abandonment, ultimately leading to productivity losses. Option C is incorrect because limiting support to executives only wastes expensive resources on routine issues and neglects the needs of other users. Option D is incorrect because random support assignment creates inconsistent service, inefficient resource utilization, and potentially unresolved issues. Post-implementation support can make or break user satisfaction and system success. No support leads to frustration and abandonment. Executive-only support wastes expensive resources on simple issues. Random assignment creates chaos and inconsistent service. A tiered support structure optimizes resources brilliantly. Picture it like a medical triage system. Level 1 handles password resets and basic navigation. Quick fixes by junior staff. Level 2 tackles workflow problems and configuration issues. Experienced technicians. Level 3 addresses complex clinical integration problems. Senior specialists. Users get fast resolution for simple issues while complex problems receive expert attention. It's cost-effective because you're not paying specialists to reset passwords, yet critical issues still reach the right experts. Everyone wins. 44. Clinical documentation shows high amendment rates suggesting data quality issues. Which preventive measure would most effectively reduce documentation errors? A. Prevent all amendments. B. Real-time validation checks. C. Delete error logs. D. Ignore quality issues. Do you know the answer? Correct answer: B. Real-time validation checks. Explanation. Option B is correct because real-time validation identifies errors during documentation, allowing immediate correction before finalization. Option A is incorrect because preventing amendments blocks error correction, perpetuating inaccurate documentation. Option C is incorrect because error logs provide valuable quality improvement data and shouldn't be deleted. Option D is incorrect because ignoring quality issues compromises patient care and regulatory compliance. High documentation amendment rates signal quality problems that need prevention, not band-aids. Preventing all amendments blocks legitimate error correction. Deleting error logs destroys valuable improvement data. Ignoring issues compromises care and compliance. Real-time validation checks catch errors as they happen. Imagine having a spelling and grammar checker that understands medical context. As providers document, the system flags inconsistencies, missing information, and potential errors immediately. It might notice that a prescribed dosage exceeds safe limits, or that documented symptoms don't match the diagnosis. The provider can fix issues instantly rather than creating amendments later. This isn't about restricting documentation, it's about helping providers get it right the first time. Prevention beats correction every time. 45. Telehealth implementation faces adoption barriers in rural communities. Which intervention most effectively addresses access disparities? A. Urban service only. B. Mobile hotspot programs. C. Eliminate telehealth completely. D. Require fiber optics. Can you guess the answer? Correct answer: B. Mobile hotspot programs. Explanation. Option B is correct because mobile hotspot programs provide internet connectivity, enabling telehealth access in areas lacking broadband infrastructure. Option A is incorrect because urban-only service perpetuates rural health disparities rather than addressing them. Option C is incorrect because eliminating telehealth removes valuable care access options for remote populations. Option D is incorrect because requiring fiber optics excludes communities without advanced infrastructure. Telehealth promises to bridge healthcare gaps in rural communities, but the digital divide creates new barriers. Limiting service to urban areas perpetuates disparities. Eliminating telehealth removes a vital lifeline. Requiring fiber optics excludes most rural areas entirely. Mobile hotspot programs provide the missing link. Think of them as digital bridges to healthcare. These programs loan or subsidize mobile hotspots that create internet connectivity using cellular networks. A farmer in rural Montana can suddenly video conference with a specialist in New York. The technology bypasses the need for cable or fiber infrastructure that may never reach remote areas. Combined with device lending programs, mobile hotspots transform smartphones into virtual clinic rooms. It's not perfect internet, but it's enough for healthcare access. 46. Security assessment reveals password sharing among clinical staff. Which authentication enhancement best balances security with workflow efficiency? A. Eliminate all passwords. B. Biometric authentication systems. C. Single shared password. D. Hourly password changes. Do you know the answer? Correct answer, B. Biometric authentication systems. Explanation: Option B is correct because biometric authentication prevents sharing while providing quick access, maintaining both security and workflow efficiency. Option A is incorrect because eliminating passwords removes essential access control, compromising system security. Option C is incorrect because shared passwords violate HIPAA requirements and eliminate access accountability. Option D is incorrect because hourly changes create excessive burden, leading to workarounds and weak passwords. Password sharing among clinical staff is a HIPAA violation waiting to happen. Eliminating all passwords removes essential access control. A single shared password destroys accountability. Hourly password changes create impossible burden, leading to workarounds. Biometric authentication elegantly solves everything. Your fingerprint or face becomes your password. Impossible to share, impossible to forget, impossible to write on a sticky note. Think about it. You can't lend someone your fingerprint like you can share a password. Each access is definitively tied to a specific person. It's also faster. A quick finger scan beats typing complex passwords. This maintains security without disrupting clinical workflow. Nurses can access medications quickly during emergencies while maintaining complete audit trails. Security and efficiency finally working together. 47. Quality metrics show care variation between providers treating similar conditions. Which clinical decision support feature would best promote standardization? A. Removal guidelines. B. Evidence-based order sets. C. Random treatment selection. D. Provider preference only. Can you guess the answer? Correct answer, B. Evidence-based order sets. Explanation: Option B is correct because order sets standardize treatment approaches based on clinical evidence while allowing appropriate provider discretion. Option A is incorrect because removing guidelines eliminates evidence-based practice standards and quality benchmarks. Option C is incorrect because random selection violates clinical standards and potentially harms patients. Option D is incorrect because preference-only approaches perpetuate variation without evidence-based justification. Clinical care variation between providers treating identical conditions wastes resources and compromises outcomes. Removing all guidelines abandons evidence-based practice. Random treatment selection violates medical ethics. Provider preference alone perpetuates unwarranted variation. Evidence-based order sets standardize excellence while preserving clinical judgment. Think of them as recipes from master chefs that still allow seasoning to taste. For pneumonia, the order set includes proven antibiotics, dosing, and monitoring protocols based on thousands of successful cases. But if a patient has allergies or unique factors, providers can modify with documentation. This isn't cookbook medicine. It's standing on the shoulders of giants. Order sets embed best practices into workflow, reducing variation while respecting expertise. Quality becomes the default, not the exception. 48. Information Governance Committee evaluates legal health record definition. Which consideration most critically impacts regulatory compliance and legal proceedings? A. Paper color selection. B. Font style preferences. C. Metadata retention policies. D. Printer brand choices. Do you know the answer? Correct answer, C. Metadata retention policies. Explanation. Option C is correct because metadata policies determine what system-generated information becomes part of the legal record for proceedings. Option A is incorrect because paper color has no relevance to legal health record definition or compliance. Option B is incorrect because font preferences are aesthetic choices without legal or regulatory significance. Option D is incorrect because printer brands don't affect legal record status or regulatory compliance. The legal health record definition impacts everything from lawsuits to regulatory compliance. Paper color and font styles are irrelevant aesthetic choices. Printer brands don't matter legally. But metadata retention policies, they're critically important. Metadata is the hidden data about your data, who accessed it, when it was modified, what was changed. Think of it as the DNA of your electronic records. Courts might demand to know if a record was altered after an incident. Regulators want proof of who made clinical decisions. Your metadata policy determines what becomes part of the permanent legal record. Keep too little, and you can't defend yourself in court. Keep too much and you might preserve evidence of mistakes. It's a strategic decision with major legal implications. 49. Beta site testing reveals unexpected workflow disruptions requiring system modifications. Which approach best manages changes while maintaining testing integrity? A. Stop all testing. B. Configuration adjustment protocols. C. Ignore user feedback. D. Random system changes. Can you guess the answer? Correct answer, B. Configuration adjustment protocols. Explanation. Option B is correct because structured configuration protocols allow systematic adjustments while documenting changes for validation and replication. Option A is incorrect because stopping testing prevents issue identification and resolution before full implementation. Option C is incorrect because ignoring feedback misses critical usability issues that could cause implementation failure. Option D is incorrect because random changes create inconsistency and prevent systematic issue resolution. Beta site testing reveals the moment of truth, when theory meets reality. Unexpected workflow disruptions surface that no one anticipated. Stopping all testing abandons the learning opportunity. Ignoring feedback guarantees implementation failure. Random changes create chaos and inconsistency. Configuration adjustment protocols provide systematic improvement. Think of it as fine-tuning a race car during practice laps. Each adjustment is documented, tested, and validated before the next change. When nurses report that medication ordering takes too many clicks, we adjust the configuration, document the change, and retest. This creates a clear trail of what was modified and why. Other sites can replicate successful adjustments. It's methodical optimization, not random tinkering. Every change improves the system while maintaining testing integrity. 50. Healthcare organization evaluates artificial intelligence implementation for diagnostic support. Which governance consideration ensures appropriate clinical oversight while enabling innovation? A. Eliminate human review. B. Algorithm transparency requirements. C. Fully automated decisions. D. Hide decision logic. Do you know the answer? Correct answer, B. Algorithm transparency requirements. Explanation. Option B is correct because transparency requirements ensure clinicians understand artificial intelligence recommendations, maintaining professional judgment and accountability. Option A is incorrect because eliminating human review removes clinical oversight essential for patient safety. Option C is incorrect because fully automated decisions bypass clinical judgment required for complex patient care. Option D is incorrect because hidden logic prevents clinical validation and appropriate use of artificial intelligence recommendations. Artificial intelligence in diagnostic support promises revolutionary improvements, but demands careful governance. Eliminating human review invites disaster. AI makes mistakes. Fully automated decisions bypass essential clinical judgment. Hidden decision logic creates dangerous black boxes. Algorithm transparency requirements ensure responsible innovation. Healthcare AI must explain its reasoning, not just give answers. When AI suggests a diagnosis, clinicians need to understand why, what patterns it detected, what evidence it weighted, what alternatives it considered. Think of it like requiring a resident to explain their differential diagnosis, not just state their conclusion. This transparency enables clinicians to catch AI errors, learn from AI insights, and maintain professional accountability. We get the benefits of AI augmentation while preserving the irreplaceable value of human judgment and responsibility. You have reached the end of our first question set. For the free complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.